I'm announcing that Alberta Health will modify our funding formula for scheduled surgery from global budgets to activity-based or patient-focused funding.
So that means funding would follow Alberta patients to where they get their surgery, whether in a hospital or a chartered surgical facility. The more surgeries performed, the more money they're paid. But could it actually improve surgery wait times, as the province says it will?
I think what you'll end up with is the efficiencies, and I would hope that our public hospitals would look at this as a way of getting more revenue.
It could mean complex surgeries are handled by hospitals, while the quicker and more minor surgeries are handled by private surgical facilities.
They will actually have increased funding for the more complex ones. And from what I hear from surgeons, they like to do the complex one. It really, it speaks to their skill sets and improves their skill sets. But they also like to do some of the more commonplace ones so that they can get a little bit of a break in between. So they like to do both.
Well, the NDP opposition says this is a step to further privatize healthcare.
When you or somebody you love needs to go to the hospital, you want to make sure that they're focused on you and the care that you need, not on getting people in and out and driving up their numbers or their competitive stats. We want to make sure that triage is based on those who are most in need, not those who can be treated the most quickly and out the door.
But some healthcare professionals say this system could incentivize healthcare providers.
The concept is very reasonable, but the devil is going to be in the details of how this is rolled out, how funding flows, what metrics are being collected, and again, making sure that particularly surgeons and anesthesiologists, work in both areas.
Well, this advocate says patient-focused funding hasn't been effective in other places.
What we really need is a workforce plan, a capacity plan, a plan to use our operating rooms, get the Royal Alex open again, doing the operations here, rather than more and more of these schemes and vouchers. A tried and true privatization strategy using vouchers in education, healthcare, and other public services.
There will be a group working on the program and a pilot, with it being implemented across the healthcare system sometime next year. Travis McEwan, CBC News, Edmonton.